Good morning, good morning, good morning. Well, I'm pleased to announce success. My new mic is working really well. Now I've worked out how to use it and how to clip it on the right way around. Oh dear. I've got a slightly different way to work today. So I'm going to talk about children and pro bono to a certain extent. Our policy on children is quite a good policy and quite workable, I think, and does away with a lot of the problems that parents complain about when they've got children. Now, I understand that most parents want their children to be seen free of charge, and I understand that most parents would like to be seen free of charge as well. So, you know, but certainly they want their children to be seen free of charge, and they don't want anyone to be making money out of their children. And so we used to have a situation, and there probably still is a situation in some NHS practices where the dentist sort of says, I'll see you, the adults, privately. I'll see the children on the NHS, but only if the adults come here privately. And this is sometimes a bit of a conundrum, a quandary for the parents, because you know, they know that the children are they may be that the children are quite happy with that dentist, but they don't want to go privately, and they've sort of got an idea that they could probably get in somewhere else on the NHS if only that particular dentist would carry on seeing their children. And they don't see why he shouldn't carry on seeing their children, because as far as they're concerned, he's getting paid by the NHS to see their children, and so why should them come and see him privately? You know, they see it's a sort of a holding the children hostage sort of situation. It's an extension of a big problem that there always was in the NHS, where when NHS treatment became loss making, or rather when the quality threshold fell below a certain level, and most dentists started getting uncomfortable with the sort of treatment that they had to do to earn not much, they then said they then started doing what we call cross subsidy, which is where they would take some profit from the private side of the practice and put it towards the NHS side to keep it going. And in many cases that meant the taking it from the adult private side of the practice and putting it towards the NHS children's side of the practice. And I suppose insisting on seeing the parents privately so that their children could be seen on the NHS is a sort of is that sort of deal, isn't it? And it's actually quite a fair version of that sort of deal, because at least the private parents are paying for their own children and not other people's children, which is which is the broad cross subsidy argument. So what do you do when you've got a fully private practice? Well, what we realised is that fairly early on that you have to make some concession to someone who, for example, doesn't want to pay £25 to have a checkup done on a 4-year-old, and but you want the children to come in early, and the parents do want the young children to be seen. You know, they want to start going to the dentist, sort of thing. So first of all, what we do is we make sure that the children's checkup is less than the adult checkup, and that's only fair enough. There's obviously a lot less to do when you're checking up children, and in fact you can pretty much see at a glance what's going on with the child's teeth. And so our new patient checkup is 78 at the moment. If you haven't been for, I think it's more than 18 months, then it's 45. And if you haven't been for more than 9 months, if you've been within 9 months, it's 35. If you have been within 9 to 18 months, it's 45. And if you haven't been in over 18 months, it's 78. Because we treat you as a new patient, yes, sort of only coming in on an ad hoc basis. So our children's checkup is $24.99, which is a hangover from, we should say really 25 now, because we don't really, in the old days we used to muck about with the pences, which I still think is a good idea. I still think $24.99 sounds less than 25, but the reason why the shops used to do that was because if someone bought something of $24.99, then they would need a penny change. Therefore, the shop assistant would be forced to ring it through the till and record the sale, rather than just take the 25 quid and stick it in their pocket if someone said they didn't want a receipt. So that's the reason for that. Now obviously that's long behind us now, but I still think the idea is good. The alternative reason for doing that is that it just makes it sound less. So it's 25 quid more or less for a child's checkup. Now, but we don't start charging that until the child is 11. And the reason why that is because we understand and recognise that most people do not want to pay. They do not have to say that their child is going to a private dentist under the age of 11. I mean, some people probably wouldn't mind, but you're not going to run a practice with a large number of child patients if you're charging children under 11 for checkups and things. Now, how do we organise that? Well, the idea is that if the child comes in with the parent, then really the additional time that it takes to check the child's teeth in addition to the parent's teeth is minimal. So if you've got the parent booked in for half an hour, or sometimes 3/4 of an hour for a checkup, it doesn't matter if they bring in a child or even 2 or 3 children for checkups, and they can share the time, and the parents, I would imagine, would want to share the time. They're more than happy to say, yeah, I'll give up, 10 minutes of chat for little Johnny to a checkup. Also, it works quite well because obviously they're coming in with their parents, not on their own. And lastly, it means that we don't feel so bad about doing the work for nothing, because at least we are doing a checkup on the parents, and that's exactly what we were scheduled to do anyway. So it's like we are getting paid for the time anyway. So why not do a bit of pro bono work on the kids? Now let's look at a few edge cases where these might go wrong. So, for example, someone rings up and says, I'd like to bring my son in for a checkup, but he's only 6, but he's coming in with a neighbour or his granny or something. Is that okay? And the answer is not really. He has to come in with someone who's having a checkup at the same time, a chargeable checkup. It's not like, if his granny's bringing it in and his granny's not registered with us and she's not interested in a checkup, then what do you do? Well, the answer is then you charge them $24.99. You say, look, I'm sorry, but but he'll end up getting charged. But the good news is that if you wait until it's time for your checkup and you bring them in with you, then they'll be free. So you're giving them good news, aren't you? The other thing is, of course, what do you do when they say, oh, little Johnny's got really severe toothache and he needs to come in urgently? And then obviously it's not then appropriate to say, well, I'm going to need to do an adult checkup at the same time. So then what we do is we then treat it on a case-by-case basis. If it's just sort of toothache where they need antibiotics or a prescription or something, then a lot of that we do pro bono. We don't charge, and they ended up getting tacked on the end of the session because usually they're at school and so they come off to school, etc. And so we just see them, have a look at their holes or lumps, and give them antibiotics and dietary advice. It's important that you give all children dietary advice. NICE says it's important that you're paying fluoride on their teeth. To be honest with you, I don't. I know there's the evidence supports that, and if you want to follow the NICE recommendations, then you should. Personally, in my 40-50 years experience, I haven't found painting fluoride on anyone's teeth does anything of any substance. It's not what I would call. The reason why it got recommended, it was because NICE did a report on children's teeth and how to cut down on the amount of children that got referred to GA extractions, and there's no evidence on anything. They really did a trawl of all the literature, couldn't find a single thing. The only thing they found was some paper that was probably written in the Bahamas by a bunch of professors who were invited by the manufacturers of Durafat to say that Durafat was good for decay, and on the back of that someone sold a boatload of Durafat. But as to whether or not that's oh God, Bennett, now what are you going to do? Look at this lot. This lot are all turning right. Okay, there are 2 turning right lanes. This is the problem. This sums up a lot of the problem in society, not just in this road junction. Let's see how it goes. A lot depends on what you find at the front. See, that lorry in the left-hand lane's not good. A lorry in the right-hand lane would be much better. And also, if you've got someone who's like spent 20 minutes queuing up and you turn right from this lane, they're going to get a bit infuriated. The thing to do is who dares wins. There's nobody inside me anyway. No honking. I've got away with it. What we'll do, we'll just get over to the left lane now. There we go. Yeah, always cross. Look at him, always cross. FP71, Lima Whiskey Charlie. Where are you going to go? Now, nowhere. But you've used up a bit of fuel, used up £5 worth of fuel in that bit of acceleration, so good for you. So yeah, so what we do is we don't charge them, but then supposing a child then, they've had their antibiotics and we decide that they need to have a couple of lower D's out or something, then we would charge them for that, And the parents, knowing that they've had like probably 2 free visits, they don't mind being charged for the substantive work. And quite often when they come in for the antibiotics and they tell, can I pay you? Or, are you sure I can't pay you something for these visits, etc., etc. And we're like, no, really, with children, we don't, we are more disposed to just do easy stuff for nothing. Because no, who wants to go home, and then the wife says, do you have a good day at work, dear? And you say, yeah, I've managed to charge a little 5-year-old who was in pain for getting his pain sorted out. And you're like, oh, well done, dear. So, and also in those free visits, you're building up a rapport with the child, aren't you? Which, if you're going to have to end up taking a couple of teeth out under local, is fine. I always put the onus on the parents when children are having teeth out, and I say, but is he grown up enough to have it done? Is he, do you think he's going to sit in the chair and have that done? Because it's although we'll get him numb, and it's not necessarily going to be traumatic. It's not going to be, he's going to have a reasonably high degree of tolerance to stuff like getting numb and having forceps placed on his teeth and stuff like that. Or I say to them, the alternative is to join a list for GA extraction, which is about 3 years long. Oh no, I don't want to do that. Well, okay, then you need to. Then you find that the parents have a quiet chat with the children and say, look, you're gonna have a tooth out, matey. And they've got them, and sometimes they're not ready. Sometimes they honestly aren't ready. Obviously, the real disasters are the ones where the parents say, yes, he's going to come in. I want you to do it. I want you to do it, and they don't take any responsibility or acknowledge that their child is too emotionally immature to have something like that done. And the other thing that the parents have to take responsibility for is the diet, is the cause. Why has the child got decay in the first place? If you get a 4-year-old or a 5-year-old in with decayed lower D's, say, DOs in the D's, that's really a very early bad sign, isn't it? That's a warning. That's the old... that's the warning sign. So obviously then you have to go over dietary advice. This is where I differ from the bulk of my profession, and I say dietary, they all say brushing. So I'm all on about cakes, biscuits and sweets and fizzy drinks. Not so much fizzy drinks, because fizzy drinks, you get decay between your front teeth with fizzy drinks. You get these tiny little like micro dot cavities that progress very, very slowly. With so mostly it's cakes, biscuits and sweets. And you can always tell the parents you're going to have trouble with, because they're the ones who say, immediately they say to the children, did you hear that? Did you hear that? No more cakes, biscuits, sweets. No more, And I say, I'm not rude to them, but I am quite blunt. I say, no, did you hear that? Did you hear that? You're in charge of their diet. They only eat what you give them. I had a mum in the other day. Her son's a bit autistic, which means he's a lovely boy, and very, actually, funnily enough, quite good to treat, because providing you're very, very straightforward and blunt with him, and say, look, now I'm going to get you numb, now I'm going to stick this needle in your gum, it's going to make your tooth go off to sleep, etc., etc., he's totally fine. But she swears blind that he only he doesn't eat anything sweet, and he only drinks water. And there he is with his lower D's need to come out, and his lower E's have got MO cavities in. So he's obviously not just eating Brussels sprouts and drinking water, is he? So really, I say, as a private dentist, don't be frightened of children. Have a policy for them. Have a sort of a method of dealing with them, and then I'm not going to say you're going to be inundated with private children, because you won't. I mean, no private dentist is ever going to have a ton of private children unless they're a private pedodontist that does GAs. But you can certainly integrate them, fit them in with your general routine, with your general practice, providing you follow these a few simple rules, and you don't need to worry about dealing with kids. All right, lovely. Oh, and once they're over 11, then we do charge them. So the free thing is under 11. Over 11, then they all pay $24.99. But then by then they'll have been to see you for 4 or 5 years, and the parents understand that. They know that once they're over 11, their needs get a bit greater. They need disclosing, they need dietary advice, they need brushing instruction, they might even need the odd filling. All right, I'll see you soon. Bye.